Now you know what it looks like when you see contractions, but what about that fetal heart rate? What is a normal fetal heart rate pattern? Well, baseline is going to be 110 to 160. If we have above 160, that's fetal tachycardia. Now, this could be caused by anything that increases the maternal heart rate, so things like fever or dehydration. What about below 110? Well, that's going to be fetal bradycardia, and that can be caused by maternal hypoglycemia. Either way, we're just going to treat the cause. So antipyretics for fever, fluids to fix dehydration, or fixing that mom's blood sugar. Now, what about the squiggly fetal heart rate that we see? Well, that's known as variability. And variability is just your baby's heart rate dancing around on that monitor. And when we look at this, we're assessing for fetal well-being. This is like Goldilocks and the Three Bears. We don't want too much or too little. So marked is going to be these big movements, which can be normal variant. And moderate is going to be reassuring or good. And this means we're just right. Moderate is our favorite variability to see. Now, remember this start point. If you see minimal or absent fetal heart rate variability, it almost looks like a flat line. And this can mean that the fetus is in a deep fetal sleep state, or it can mean that we have fetal hypoxia, which means trouble. So we need to assess this minimal or absent fetal heart rate variability a little further to make sure we're not in trouble. So if you have minimal fetal heart rate variability, we'll monitor, but we'll try to wake that baby up with a vibroacoustic stimulator. Now, if that is minimal or absent variability accompanied by fetal bradycardia, so that heart rate is less than 110, then we have fetal hypoxia. And that means we need to provide our intrauterine resuscitation or stop-in. Now, what is stop-in? Well, stop-in is our emergency checklist for non-reassuring tracings. And the NCLEX loves to ask about these interventions because they want to be sure you know how to respond and fix that fetal heart rate. So anytime you have a non-reassuring fetal heart rate, you're going to provide these interventions. So we'll stop that oxytocin or give a tocolytic to slow or stop those uterine contractions, since those could be causing the fetal distress. We'll give oxygen if that mom's hypoxemic, so we can make sure that fetus is getting enough oxygen. We'll do some repositioning, so preferably left lateral for that mom, and increase IV fluids. And these are going to help increase uteroplacental perfusion. And then of course, we'll need to notify that healthcare provider. All right, time for your first NCLEX quick check. So pause and try to answer. What does minimal or absent fetal heart rate variability without fetal bradycardia indicate? What interventions did you perform? Well, this indicates a deep fetal sleep state, which can be okay, but we want to attempt to wake that fetus with a vibroacoustic stimulator. What does minimal or absent variability with fetal bradycardia indicate, and what interventions did you perform? Well, this indicates that we have fetal hypoxia, which is not good. So we want to perform our stop-in interventions. So that's stop oxytocin, tocolytics, give oxygen, positioning, preferably left lateral, increase those IV fluids, and notify that healthcare provider.